morning to my dear students.
So today we are going to discuss about the passive movements. You know the movements, we have learned in theory about the movements. We have passive movements. So movements we are mainly divided into active movements and passive movement. Active movements again divided into free exercises, active assisted exercises, and passive movements, manual passive movement and mechanical passive movement. So we know all the divisions of the movements. So in that we have passive movement. Passive movement we are teaching you here, and you are not supposed to do alone to the patients, only under the supervision of a trained physiotherapist. You can do it by side. In some patients they will be contracted and one person cannot do alone the movement, so they need the assistance of another one. So you need to be there to assist and do the movements under the supervision of a physiotherapist. So before starting, you need to clean your hands. We know that hand washing techniques we have studied previously, and you should not have any rings or bangles or watches, and your hair should be tight, and you should not have this chain hanging. Okay, so everything we should keep, and you should not disturb the patient. And you first, when you are going to the patient, you have to remove the cover and any obstacles, pillows, position. The patient should be positioned in side lying or sitting or whatever position. So you have to keep the patient in the supine lying position, and if the patient is having any ornaments or watches or anything which is going to be disturbed, you need to remove. And if any IV lines or anything, you have to inform the nurses to remove it for you, because if you are while moving, there is a chance to come out. So before starting, you have to inform the nurses to remove anything applied to the patients if they can. Otherwise, you need to be more conscious about these things. Okay. So we will start with the movements of the shoulder girdle. You know that shoulder girdle is having the movements of protraction, retraction, elevation and depression. Okay. Shoulder girdle is having 4 movements. For doing that, we need to position the patient. His shoulder should be free and away from the pillow. And see, I am holding the shoulder and keeping the shoulder girdle in my hand. Okay, and I am doing the protraction, neutral and retraction. Retraction, by doing the retraction, I am keeping my underneath arm, hand upwards, so then only we are going to get the movement of retraction. Okay, protraction, neutral and retraction, protraction, neutral and retraction. In some cases, if you need to get properly, you can position the patient completely, patient's shoulder out of the bed, so you will be able to do it properly. Protraction and retraction, if you can. All the patients you cannot move it in this position, because the patient is in muscle power grade 0 to 1 or 2, so it will be very difficult. But in any chance, if you can do it like this position: protraction, neutral and retraction, and elevation and depression. For doing this elevation, you need to hold your hand on the inferior angle of the scapula, and another hand, elbow and forearm is supported on your forearm, and see, you are doing this elevation and depression. Your fingers will be hooking on the inferior angle of the scapula. This is elevation and depression. Elevation, depression. And all this movement you need to do in a slow and rhythmic movement, and you need to do at least 10 to 15 times to get the effect. Okay, so now we move on to the movements of the shoulder, passive movements of the shoulder. So we know that the movements of the shoulder is shoulder flexion, extension, abduction, adduction, internal rotation and external rotation. So all the movements we will do for the patient passively. Okay, for the patient who is not having the strength to do the exercises actively, we are doing to maintain the range of motion, muscle strength and prevent the contraction, and you know all the effects. Okay, so shoulder flexion, we are holding, see this is the hold. Okay, elbow supporting and wrist supporting, and see my hands are in a crossed way and I am doing, so my hands are free to move, and see what's my position of the leg. I am in walk standing while doing this exercise. Okay, this is the passive movement, flexion of the shoulder. Okay, flexion of the shoulder. See my hands coming cross way and my hand flexibly is getting free. You will be confused for doing that. See the down hand, my right hand is on the elbow and my left hand is on the wrist joint. Okay, and you know the principles of passive movement: fixation, support, traction, speed and duration. Right? This is the flexion of the shoulder. Now we will do the extension in side line. Okay, later on. So now we will go to the movement abduction and adduction. Abduction, this is the neutral position, and this is adduction. Abduction, this is the neutral position, and this is adduction. And we will do the internal rotation and external rotation. See, I am holding the elbow and wrist. This is internal rotation, this is external rotation. Now we describe flexion, abduction, adduction, internal rotation and external rotation. Now we will do the extension of the elbow. We will just keep the patient in side lying position and hold the shoulder joint and support the forearm and hold on the elbow and then do the extension. Okay, this is extension of the elbow. So we need to do it in slow and rhythmical manner. It should, we are doing on a patient who is suffering, so we need to be empathetic and we should know that this is, I am doing on a model, but on doing the patient we need to understand his situation. It should never be painful, it should be calm and soothing. Okay, so each movement you will do in complete range of motion, complete available range of motion. Okay, so now we completed the shoulder. Now we will go on to the elbow joint, passive movements of the elbow joint. We know that in the elbow we are doing flexion, extension. Okay, and radial joints we have the movements of pronation and supination. You know how to pronate and supinate. Flexion, extension. Now we will do these movements. Okay, just holding the elbow and wrist and doing the flexion. The thing you need to take care is that you should not keep your thumb here. So if you keep thumb, you will not get a full range of motion in between. So you should keep your thumb away. Just hold here and then do flexion, extension in slow and rhythmic manner. Flexion, extension, flexion, extension, flexion, extension. Now we will do the pronation and supination. So see the my holding my index finger is on the forearm and thumb, and the other three fingers are holding the palm. Okay, holding the elbow with my other hand and then just giving a traction and doing pronation and supination. Pronation, supination. We know that these movements, pronation and supination, is doing by superior and inferior radio-ulnar joints. Okay, this is pronation, this is supination, and we know that priests pronate and beggars supinate. No confusion. Pronation, supination, and the movements of the wrist. Next, see, we are holding on the inferior aspect of radius and ulna and the palm. See, my fingers, thumb is on the posterior aspect of the forearm and all the fingers are in front. This is flexion, extension of wrist. Flexion, extension, ulnar deviation and radial deviation. You know where is radius, where is ulna. Ulna is on the medial aspect, like this is ulnar deviation, this is radial deviation. Okay, now flexion, extension, ulnar deviation, radial deviation. Now you will do the metacarpophalangeal joint flexion and extension. Flexion and extension. We are doing all the fingers together except the thumb. Flexion, extension, flexion, extension, and proximal interphalangeal joint. See how I am holding. These are the proximal interphalangeal joints. So I am holding the proximal phalanges and doing the flexion and extension. Then distal, and we can do it together, all the interphalangeal joints in this way, or we can do individually all the joints. In case of if the hand is stiff, we will do individually to all interphalangeal joints. Okay, passive movements in slow and rhythmic manner in full range. Now the thumb, flexion, extension, adduction, abduction and opposition. See, with the thumb going and touching the finger tips or other fingertips. This is opposition. Flexion, extension, adduction, abduction and opposition. These are the movements in the thumb and interphalangeal flexion and extension. So now we have discussed about the passive movements of shoulder girdle, shoulder joint, elbow joint, wrist and full hand. Okay. Now we have discussed about the passive movements of upper limb. You all try to practice with your brothers, sisters or mom and be conscious you are doing on a human being and be careful. Okay, so once we will start our school, we will try to do it again, but practice yourself. Okay, thank you. you.